Every physical therapy student goes into physical therapy thinking they're going to treat patients and help as many people as possible. As I was gearing up and finishing out my last clinical rotation, dreaming up of all the possibilities of what kinds of patients I would treat and how much manual therapy I would do, with every patient getting 100% better, after spending all day with my 5 patients a day, with insurance covering 100% of the cost, I was quickly met by a small, insignificant little blip called the COVID-19 pandemic. This affected everyone in healthcare, including myself just entering the workforce. Here we are at ATI Physical Therapy, paving the way for new ways and innovations for healthcare, while I am seeing patients over video in their pajamas. As a new grad, I had no idea what I was getting myself into, but I had had a lot of outpatient ortho experience in my clinicals and started treating patients in clinic while we were launching ATI Connect. One of my very first patients on telehealth was one who needed my help 600 miles away from where we were in Bolingbrook, Illinois. We'll call her Jan. She was a 74-year-old woman who was severely depressed and lived in a rural part of Minnesota where the closest health care was 1.5 hours away. She lacked motivation to do anything and was going through the motions to appease her husband. Because she was a high fall risk, she really needed someone to help guard her during her physical therapy. The questions and the thoughts ran through my head. Oh, great. One of my first patients is a balance patient. How are we going to treat this lady on telehealth? And how will we be able to even motivate her to do this? And how will we connect to build trust? As I thought about these questions, I was faced with the reality that treating via telehealth was going to be quite different than treating in clinic. However, since Jan was my patient and she did not have access to physical therapy by any other means, I and my PTA were it. She did not have any other options. Now, we're not utilizing manual therapy for any tight muscles or to build therapeutic alliance. We cannot put our hands on Jan to guard her. We're not using our hands for any tactile cues. We ended up having to utilize 4 different key areas that ended up translating to other telehealth patients over the years. Firstly, with all telehealth patients, we have to get creative. Compared to the clinic, access to equipment at home drastically varies from patient to patient across different states and homes. We're not power lifters with home gyms everywhere. With Jan, I was able to utilize pillows as foam pads and find buckets and gallons of waters to use for obstacle courses. Uneven terrain was walking across pillows or outside. Weights were ounces of water with a 16-ounce bottle to a pound. With some other patients, though, I've utilized laundry baskets, babies, children, dogs, cats, horses, and many other items. Going back to Jan, guarding was done by Jan's husband after teaching him appropriate ways to guard. I would describe objects or types of objects I would need, and Jan's husband and I would work together to find a good solution. Secondly, with telehealth patients, we have to utilize our time wisely by addressing the most important items for the day. With Jan, she got tired more quickly because we focused on the most important exercises within the allotted time that we had, where we moved from one exercise to the next, challenging her. Prior to us being able to initiate balance training, we focused primarily on strengthening and gait, as standing was already difficult for her. Compared to the clinic, our 30 minutes of time together is much shorter, but on telehealth, it's just enough time for us to be able to get to provide what's needed for Jan to be able to continue to progress towards her goals. Now, we're not spending time on warming up on the treadmill or the bike. We're not spending time on manual therapy or modalities. We focus primarily on Jan working actively to get herself better rather than passively, which allowed her to get better more quickly. Thirdly, we had to find ways to motivate and inspire. One of the primary difficulties for Jan was that she was struggling with depression. So getting her involved with her care was difficult, but crucial. She would have very few words to say, did not care to engage in much conversation. When conversations about her daughter came up, however, she would chime in with little bits of information about her grandchildren. Ding, 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 we have a winner, a way to emotionally invest. She shared that her only daughter and her 2 grandchildren lived overseas in France and that she rarely saw them. Her husband and I worked together to get her daughter and family to come visit for a month. It was awesome. This is when I saw tremendous improvements by leaps and bounds. By the end of our therapy sessions together, she was able to walk with her 2 small grandkids in the garden, an activity that she loved. Finally, when it comes to utilizing the technology for telehealth, I have overall had to become a better clinician. I have gained insight into patients' worlds where I would not have had the opportunity had I not been in their home or their workplace. I have interacted with the people in their day-to-day life and the most common areas of struggle in their homes or workplace and work with them right then and there. I've had to find ways to address the functional limitations while finding out what standardized functional assessments we could utilize to test and retest limitations. I've had to maximize every possible resource I had to help patients like Jan be able to make a full recovery. Now, there are a lot of Jans out there who we can only reach on telehealth. Had it not been for ATI paving the way, telehealth and ATI Connect would not be what it is today. And if it weren't for the COVID-19 pandemic, I would not be where I am today. I am forever grateful to Jan and all of my patients on telehealth. Thank you for making me the clinician that I am today.